The doctor is in. It's On Call with Dr. Howard Smith.
Dr. Smith is ready to take your calls about the latest news and trends in the world of medicine.
And now, Dr. Howard Smith.
Hi everybody, Dr. Howard Smith in and at your service, and today we're going to talk about a disease that affects us all, colds. We know that we all get them, some 5 to 7 colds a season, yet we know very little about how to effectively treat them. There are some 1 billion colds that occur in the United States every year, and that leads to some 60 million lost school days because colds, of course, affect little kiddies, those in my practice. And not only are the colds devastating, but they lead to devastating ear infections and sinus infections. In adults, colds lead to some 50 million lost workdays, and that translates into some $25 billion in terms of lost productivity. Actually, although we really don't have a good handle on how to treat colds, we spend $5 billion every year on non-prescription remedies, and that leads to a total of about $500 per family. So a lot of people say, why treat colds? After all, they're self-limited, they're just viral infections, they're going to go away. Well, that is true, but as I point out, they do ignite bacterial infections, leading particularly in kiddies to middle ear infections and sinus infections. So we definitely want to have an effective way of coping with colds. And if you look on the internet, look it up, cold treatments, what are you going to find? Well, you're usually going to find, drink lots of liquids, get lots of sleep, maybe a little vitamin C. All of those elements are considered to be good cold treatments. But you know what? They usually don't work effectively. And the fact is that it is important to effectively treat the side effects of the cold viral infection in order to prevent the secondary bacterial infections. So, we're going to talk today about a plan that does work. I'm going to present to you my ABCD plan for managing colds. I'll also talk about other helpful things to do. We'll talk about what not to do, because there are some things that you shouldn't be doing which are counterproductive in terms of getting rid of the cold. And then we'll talk about how to prevent colds. Preventive medicine is always the best, and we'll talk about how to do that, as well as myths about colds. So, the ABCD program that I have developed over many years working with patients and their parents, and it is a program which fundamentally seeks to prevent many of the side effects of the viral infection. It's safe. That is, most components are topical, and one of the main criticisms about treating colds in children, particularly infants and children, has been that the topical medications that typically have been used, namely antihistamines and decongestants like Sudafed, are somewhat risky. They have some side effects. Well, most of the medications in my program are topical. And when we do use oral medications, they are carefully dosed by weight so that they can be used safely by children of any age, including infants. All these medications are available as well. They are available without a prescription, and the program is simple. It's as simple as A, B, C, D. Minimal parental supervision is needed for older children as well. They can do it themselves, and they should learn how to take care of their own bodies. Most of all, this system is effective. It has been used by me and by parents under my coaching for thousands of episodes of colds in many, many, many thousands of children. And so we know it works. What is the program? You give a child 4 elements 3 times each day during the week of a cold, because most colds last a week. That's how long it takes for the body to eliminate the viral infection. And they shouldn't last longer than a week. But during that week, you give them 4 elements in the program 3 times a day. And that's roughly about every 6 hours, say 8 in the morning, 2 in the afternoon, 8 at night. You can vary that a little bit. So what are the 4 elements? The A, B, C, D. A stands for anti-inflammatory. B stands for bacteria killer, C stands for cleanser, and D stands for decongestant. So let's look into each of these so you understand what they are, and then we'll talk about how you combine them together. But fundamentally, each of those three administration times, 8, 2, and 8, you take a quick anti-inflammatory by mouth, use the topical bacteria killer, use the topical cleanser, and the topical decongestant. Anti-inflammatory. Well, what are we talking about here? Well, you're already familiar with the most common anti-inflammatories that there are. Ibuprofen, Advil, Motrin, or the store brands. Now, adults, those over 21, can substitute for ibuprofen aspirin. Aspirin is quite effective as an anti-inflammatory. I prefer it. But when you do use it, you should use it in a non-gastric irritating form. We'll talk about that. Why don't you use aspirin in children under 21? Because it is associated with Reyes syndrome, which is a necrotizing hepatitis. It is devastating. It is lethal. Don't use it. So these are the anti-inflammatory medications, and here's children's Advil, comes in different flavors, and then we have also the Advil tablets, look like little M&Ms, and that can be used by adolescents, of course adults too, and as we mentioned, aspirin for those over 21, Ecotrin right here, and I personally enjoy using that. Works very effectively. Why anti-inflammatories? Well, because they prevent a lot of the side effects of the viral infection, including nasal lining congestion, nasal obstruction. They prevent the linings from secreting so many mucus compounds and prevent postnasal drainage. So anti-inflammatory, why anti-inflammatories? Well, they prevent the side effects of viral nasal infections, simply lining congestion and nasal obstruction. Prevent the secretions, the mucus secretions, from being as voluminous as they normally are. And when they are voluminous, guess what happens to them? They go down the back of your nose and cause coughing. They prevent some of the irritative effects of the viral infection, which leads to sneezing, irritating the nasal linings, and when you irritate the airway, you get coughing, and the ibuprofen prevents that. Obviously, we know it prevents fever, pain, and that general yucky feeling when you have a cold. But the main reason for using the ibuprofen is to prevent many of the congestion and fluid secretion elements in the cold. All right, let's move on to cleansing. What are we talking about here? Well, here we're talking about the use of aerosol saline products, which are available as Simply Saline, as Ocean, or as Little Remedies for Noses. And they're spray bottles. Why do we like the aerosols? Well, simply because they have one-way valves, and unlike the squeeze bottles, where if you squeeze the agent into the nasal cavity by touching the nostril, bacteria will be transferred to the tip and then end up being sucked back into the bottle when you release the squeeze bottle. That does not happen with the aerosols. They have a one-way valve. They're very safe. Remember, too, that you can buy the store brand aerosols at CVS and other chain stores. And the way you do it is you simply apply the spray into the nasal cavity, like this, and here's our spray bottle. This is Simply Saline, and you just simply place it in the nasal cavity, and I like to aim it toward the eye because what happens is that will tend to spray the side wall of the nose. And just spray a little, do each side, spray it against the side wall of the nose. It's very simple and very clean and very, very effective. So these are the agents that we use. They're the name brand Simply Saline, and then there are the store brands from CVS and Walgreens. Now, there is a baby Simply Saline that people see on the shelf, and the question is, should you pay the extra premium for that product? I say no. Fact is that it's the same saline that is in the other products, and the nozzle is a little bit different, but actually not any smaller. It does reduce the flow of mist into the nasal cavity. But frankly, I think many of these little children need the standard force of mist to really get the material in there. So I'm saying stick with the standard saline. And don't, by the way, buy any hypertonic saline or special flavored salines or any of those. Stick with the standard saline. That is really what you want. All right, so why do we cleanse? Well, because we want to wash away the contaminants. We want to keep the mucus that does develop in the nasal cavities from becoming too thickened. We want to moisturize the nasal cavities. And then, since we do the cleansing after we apply the antibiotic ointment, we want to distribute it backward into the nasal cavity. And of course, we just want to generally cleanse the nasal cavities as well. Finally, the most important element in the ABCD program, decongestion. This is all important because when the nasal cavities are swollen, a lot of mucus accumulates, everything sludges, and also the decongestion has a drying effect. These agents not only open up the nasal cavity, but they also slow down the production of mucus and slow down the production of secretions, which is important for maintaining a clean environment within the nasal cavity. Now, the agents that we use are different depending upon the age of the child. And this is the one instance topical agents are somewhat different. For infants, those who are birth to 2 years of age, we use a very dilute, a very mild form of a topical decongestant. We recommend Little Remedies for Noses, decongestant nose drops. Now, comes in a dropper. That's not the best way to administer products into the nose. So for those individuals who are using them in infants, I do recommend purchasing some of the pump sprayers, which you can do online. If you're not sure where to get them, you can just do a quick search and it will identify where you can buy these little bottles. They're very cheap. You get about 6 for $4, and the postage actually costs more. So that's infants, birth to 2 years of age. 2 to 6, we recommend mild neosynephrine, which is a little bit stronger than the infant agent, and it comes in a spray bottle, but again, you can use the fancier You Purchase It spray bottles, which are excellent. And then for anyone 6 and above, that would be children, adolescents, adults, you can use Afrin. Now, Afrin's a dirty word. A lot of people say, well, I've heard that Afrin is going to make my nose fall off if I use it for more than 3 or 4 days. Untrue. That is absolutely untrue. Your nose will not fall off. In fact, it's been restudied, and you can actually use Afrin for almost 3 weeks without having any real problems. So you can use Afrin, or you can use the no-name oxymetazoline nasal spray, either of those. So let's take a look at these products. Here we have for the infants, Little Remedies for Noses. Now notice it's a decongestant nose drop, and that's why you want to buy the spray bottle. For the children 2 to 6, we use mild neosynephrine. Make sure you get the mild. Do not get the regular or extra strength. That's way too strong for these children. And again, it comes in a spray bottle, but again, if you like, you can get the pump bottle. The other advantage of the pump bottle is that it has a one-way valve similar to the aerosols, and it makes it safer to administer any of these sprays. And then, of course, for those 6 and above, Afrin or oxymetazoline in a pump spray bottle, or you can buy the squeeze bottle where you actually get more for the buck and then put it into your no-name do-it-yourself spray bottle. Now, why topical decongestants? I mentioned that they do shrink nasal linings, permit free flow of air through the nasal airways and in the sinuses. So again, just a reminder, when you administer spray into the nose, and that includes the topical agents, always spray and aim toward the eye. You want to spray so that it's going in the direction of the sidewall of the nose. It also prevents excess nasal secretions and dries the nose as well. Now, sometimes we have instances where you're giving all elements of the ABCD program, yet the child still is stuffy, drippy, and coughing. Coughing is a sign of too much postnasal drip. And how do we deal with that? We administer oral decongestants. And these oral decongestants must be dosed by weight, and there are different ones depending upon the age and the weight of the child. For the smallest kiddies, you may use the Sudafed nasal decongestant liquid, and this is dispensed by the pharmacist. Sudafed is a semi-controlled substance. The so-called Sudafed PE that you find on the counter, on the shelves, is not real Sudafed. Do not buy it. Do not buy Sudafed PE. Stick with regular Sudafed that you get from the pharmacist. So, for the little kiddies, use the Sudafed liquid for infants and children. For little older children who can take pills, you can use the little red Sudafed tablets, the 30 milligram Sudafed tablets. And again, all of this is 3 times a day. The ABC, the anti-inflammatory, the bacteria-killing ointment, the cleansing saline, the decongestion elements, both topical and, if you need them, oral, 3 times a day. For example, 8 in the morning, 2 in the afternoon, 8 at night. Make your own schedule, but 3 times a day. So let's look at the actual agents. This is children's Sudafed liquid, and this is the Sudafed PE, which do not buy. I would not recommend it. It's not effective at all. For the next group of kids up, we have the Sudafed tablets, the 30 milligram tablets, and again, usually one of these 3 times a day. For older adolescents, we have the Sudafed 120, the long-acting Sudafed, and that's for adults as well. Again, Sudafed PE should be avoided. So why oral decongestion? Because it adds to the topical decongestant when needed. It stops the postnasal drip and stops the coughing. So that's the ABCD plan. It goes very quickly, and it's extremely effective. So, what other things can you do to help colds? Well, first of all, humidification is very important. You want to keep a child or adult room 40 to 50% relative humidity. You really need a humidity gauge, which you can buy for $8 to $10, either at your nearby Ace or True Value store or online. You want to use a warm type humidifier. Why? Because the cool mist ones tend to get contaminated, and you're actually just spraying contaminated droplets into the air. Warm mist humidifiers are actually producing pure water molecules, water vapor, clouds of pure water that go into the air. I do recommend when you use a warm mist humidifier that you do put a fan behind it, because that will help distribute it much more effectively. Now, fluids, rest, and conservation of energy, sure, those are fine. But don't omit the ABCD plan. You can do it very, very quickly. You take your pill, you grab your ointment, you put it in there. It takes but a second. Put it inside. Do the other side. Then you spray in your saline. That takes but a second. Very quickly. Very quickly. And then the last thing you do is you spray your Afrin. And again, aim it, or your mild neosynephrine, or the little baby stuff. And again, you aim it at the side wall. See how quickly I did that? It takes less than a minute to do it once you have all of the materials gathered. What not to do? There are things that you should not be doing, and here's one of them. You should not be blowing your nose, and we'll explain why. You should not suppress the cough without suppressing the cause. So, for instance, if a child begins to develop coughing while he or she is using the ABCD program, add the Sudafed, because that will tend to dry up and prevent the postnasal drip that's causing the cough. If all you do is put the child on cough medicine rather than suppressing the cause of the coughing, you can end up with severe bronchitis or even a pneumonia. Nose blowing, why not? because nose blowing forces contaminated material from the back of the nose, which is more contaminated, to the front and into the sinuses and into the ears. So, very simple. Don't do it. Let's take a look. Little girl blowing her nose, blows material up into the eustachian tube, which is over here, blows material up into the sinus linings, and that is counterproductive. Suppressing the cough. As I mentioned, coughing caused by postnasal drainage. So you need to stop the postnasal drainage. Very simple. How to prevent colds? How do we prevent colds? Very simply, hand washing can be extremely helpful. Saline spray, the same saline you used as the C portion of the ABCD program, the aerosolized saline, and then consistent and controlled humidification that we talked about before. Those all will help prevent colds. And those children who regularly use the saline spray have been found statistically to have fewer colds. Hand washing. Cold viruses and the secondary bacteria associated with colds are passed not only person to person via the air, but also via hand to hand and hand to skin contact. So try to wash the hands every 2 hours at play or during school, and particularly before leaving home and when coming back. Use soap, water, and a clean towel. You don't have to use anything fancier than that. The saline irrigation we've talked about, I again emphasize, to get the spray, do not use squeeze bottles. Buy the aerosol spray. It's safer. And again, it irrigates the nasal cavities, washes everything out, keeps it clean, keeps it open, and it is extremely useful. How to prevent colds? Consistent humidification. We talked about that. Comfort zone, 40 to 50%. Buy the gauge, so get one. Moist throat linings and nasal linings. Help those linings and their conveyor belt protectors work more effectively. Those are the protectors that move contaminated material out of the nose and throat in the direction where they need to go. So you should keep them moist. Humidification helps you do that. And again, let me emphasize, you want a warm humidifier, put a fan behind it. Also, moist linings protect your vocal cords from drying out. So that can be extremely helpful as well. And interestingly enough, properly humidified room air contains fewer dust and allergy particles. So that's a help as well for people who have perennial allergens. What are the myths about cold? What are the things that, the myths about colds that people tell us? Susceptibility to colds indicate a weak immune system. Not necessarily true. And becoming cold or chilled leads to catching a cold? No. The only place that was ever found to be true was in Antarctica, and most of us, fortunately, aren't living in those conditions, at least not yet. Having a wet head leads to catching a cold? No, the wet head is dead, but that's not important in terms of cold prevention. Now, having cold symptoms is good for you. The people who like to punish themselves by letting a cold run wild without using effective management, such as the ABCD plan, are just kidding themselves, because studies have shown that you need not necessarily be miserable to eliminate the cold viruses. Drinking milk causes increased nasal mucus, and that's counterproductive. No, not important and not relevant at all. Feed a cold, starve a fever, forget it. Chicken soup, well, everybody likes chicken soup, and there are some elements in it that have been found to stimulate the immune system, but there's never been a good controlled study using chicken soup to see whether, in fact, those who are using chicken soup alone effectively makes the cold significantly shorter. Maybe a little bit shorter, but not important. Vicks Vapor Rub on the feet suppresses a cough. That was something running around the internet some time back, and I think it has been disproven in subsequent studies. Wearing garlic prevents colds. Well, only insofar as wearing garlic or eating garlic keeps people away from you, and so you're less likely to get sprays of contaminated material into your airway or to touch their hands if they're contaminated. Vitamin C prevents colds. Well, you'd have to take a ton of it. Linus Pauling was a great chemist, but probably not a fabulous doctor. Let's review the ABCD plan. This plan does work. It's extremely effective. In fact, right now, I actually have a cold while I'm recording this video podcast. And you haven't seen me raise a Kleenex, you haven't seen me blow my nose, and you haven't seen me coughing or sniffling. That's because I'm using the ABCD plan as you and I speak. Reviewing it, A, anti-inflammatory, pop a pill, give your child a little liquid. B, the bacteria-killing Neosporin or the triple antibiotic ointment on a Q-tip for the younger babies or on a finger for the older children and adults. C, the cleansing saline. You spray it against the side wall by aiming toward the eye. And D, the topical decongestant. And again, for babies, the little remedies for noses, the drops as a spray. For the children 2 to 6, it is the mild neosynephrine or an equivalent product as a spray. And for those 6 and above, it is Afrin or oxymetazoline as a spray. It is effective 3 times a day, 8 in the morning, 2 in the afternoon, 8 at night. Again, let me just reiterate the features. It's safe. The products are all available. It's easy as ABCD, doesn't take any time at all, and most of all, it's effective. We have used it in thousands of children, and parents find it extremely easy to use. Thanks very much for watching, and try it the next time you get a cold, and certainly try it for your children.